If you are shot or stabbed, it is critical to act quickly and calmly to reduce the risk of serious injury or death. Here's what you should do. Immediately call emergency services. Provide clear information about your location and the nature of the injury. Control bleeding. Use a clean cloth, bandage, or even your hand to apply direct pressure to the wound. If the bleeding is severe, this can help slow it down. Use a tourniquet if necessary. If the bleeding is severe and cannot be controlled with direct pressure, for example, from an arm or leg, you may need to use a tourniquet. Apply it above the wound closer to the body to help control the bleeding. Stay calm. Panicking increases your heart rate and could worsen the bleeding. Try to stay as calm as possible and focus on controlling the bleeding. Slow, deep breaths. This can help manage pain and keep your mind focused while waiting for help. Do not remove a knife, bullet, or any foreign object. If you have been stabbed, leave the object in place, as removing it could cause further damage and increased bleeding. Apply pressure around the object to stabilize it without moving it. If stabbed in the chest, try to keep calm, and if possible, sit up or keep your upper body elevated to allow for easier breathing. If stabbed in the abdomen, lie flat on your back to prevent further injury and minimize movement. If shot in extremities, try to stay still and avoid moving the affected area, as this can worsen the injury or cause more bleeding. Cover the wound. If you have a clean cloth or bandage available, loosely cover the wound to help prevent infection. Don't apply pressure on it unless you're controlling bleeding. Wait for help. Even if you're conscious and able to move, trying to drive yourself could be dangerous. Wait for emergency responders who can provide appropriate care. Stay alert. Try to stay awake and conscious. If you begin to feel faint or lightheaded, lie down with your legs elevated to help maintain blood flow. When help arrives, give the paramedics any relevant details, including how you were injured, whether you lost consciousness, and any pre-existing medical conditions such as allergies or heart problems. Additional considerations. For gunshot wounds, pay attention to the entry and exit points. Gunshots can cause internal damage even if the external wound seems minor. For stab wounds, a deep wound, especially to the abdomen or chest, can cause serious internal bleeding, so medical attention is crucial. If you are with someone who has been injured, keep them as still and calm as possible while you call for help and provide assistance as outlined above.